Uh, so we are live on YouTube. Over to you, sir.
Thank you, Avinash. Very good afternoon, everyone. And at the outset, let me wish everybody a very happy 75th Republic Day of India. And I'm sure all of you must be very happy with this day where we are focusing on a lot of things which are very, very dear to us. As you know, National HRD Network is the largest body of HR professionals in India, and we have a very strategic tie-up with Karkinos. I'm really delighted to welcome Suresh ji. Thank you, Suresh ji, for joining
Thank
us
you.
here for this session. I
Thank
would
you.
like to invite Dr. Anbu. Thank you, ma'am. Thank you for joining us for this very, very important session. I must welcome the team from Karkinos and National HRD Network for joining us here. And I have been told that over 300 participants have already registered for this very important webinar who are joining us on different platforms. So the topic is very, very important, and I am also conscious of the fact that this topic is very, very important to us, whether it is in our roles in the organization or as a part of our families at our home. So I am really grateful to Karkinos for really taking charge and being one of the institutions at a pan-India level taking care of this subject. And today's topic will be focusing on one very important part of the endeavor, and I will request the organizers, particularly I'll hand over to Purvika ji to take the session forward. Before that, once again, let me thank you for joining us here today. And I welcome each one of you. And with these few words, let me hand over to Purvika ji. Over to you, ma'am, please.
Thank you very much, Mr. Dhananjay. I extend a warm welcome to each of you gathered here today. And on behalf of Karkinos Healthcare, I would like to thank the NHRDN network for their support in organizing and hosting this significant event. In today's gathering marks a special collaboration between NHRDN and Karkinos. And as we convene here, it is noteworthy that this event holds special significance, it being Cervical Cancer Awareness Month. And with that being said, it is an honor to introduce our distinguished speaker for today, Dr. Anbukani Subbayan. Dr. Subbayan is a highly regarded consultant gynecologic oncologist and robotic surgeon at the Kovai Medical Center and Hospital in Coimbatore. With a wealth of expertise in the field of gynecologic oncology, she has become a beacon of knowledge and innovation. In addition to her clinical practice, Dr. Subbayan holds key academic roles, serving as the editor of Oncology of the European Journal of Obstetrics, Gynecology, and Reproductive Biology. Furthermore, she contributes to the field as a member representative on the International Representative Council, South Zone RCOG India. Dr. Subbayan's global recognition is a testament to her outstanding contributions. She has been honored with the prestigious fellowships, including the fellowship in GYN Oncology with European Society certification. Noteworthy among her accolades is the Australian Society of Gynecologic Oncologists Fellowship, along with a clinical attachment at the Royal North Shore Hospital in Sydney, Australia. In 2016, she was bestowed with the Shingo Fuji Young Doctors and International GYN Cancer Society Fellowship in Lisbon, Portugal. Please join me in welcoming Dr. Anbukani Subbayan as she shares her invaluable insights with us today in light of Cervical Cancer Awareness Month. Over to you, Dr. Anbu.
Thank you so much, Pulvika, for that very kind introduction. Thank you, Suresh, for having me here this afternoon in the month of January, which I know is very close to your heart as well as to mine, because the bulk of my practice as a gynae oncologist, I'm having to deal with cervical cancer patients. And this month is actually Cervical Cancer Awareness Month. And we put all our efforts. Why do we have these months and days? Is basically on a normal day, there's so many things that capture our attention that we have to divide our time between. And when there is a designated time for, like for the Republic Day, then we have to think back and look at the plurality of the society and the freedom that we've achieved. Cervical Cancer Awareness Month, first of all, I think helps us to commemorate the memory of all the women that have and are still losing their lives to a very preventable cancer. And I think to strengthen our objectives, to do our best in helping to raise awareness and helping to save women from this very deadly cancer. So I think when there is a month that is commemorated, you bring your attention and your focus back to realigning on whether you're doing the right thing. Are you achieving your goals? Is there something more that you could do apart from remembering all the women that have lost their lives in the past many, many years? But thanks to science, there's so much that we can do. And I'm hoping in the next 20 to 30 minutes, my talk to all of you will help you do your own bit. Even if you are not directly involved in the care of women who are affected by these cancers, there's so much more that we can do to women who are completely normal so that they don't end up under my care. So basically, I'm just hoping that this amount of information that you get will get utilized, because my thing that I always say at these lectures is many times it becomes a tick box that we have to do. That we have to have this many number of meetings, we've got to hold this many number of walkathons. But if you do not translate what you hear in this meeting and take it back to at least a few people, starting from your family and then your community, then there's no point all of us putting our time into this meeting and me talking and you listening, right? So if it's just a tick box, it doesn't make sense. So I really hope that you can take one simple action after this, starting from your own homes, and then of course take it forth to your community. Then it'll be worth my while today. So Purvika, can we have the slides so that I can start off? In India, cervical cancer used to be the #1 cancer until a few years ago. I think 2018, breast cancer started creeping up because of the huge change in lifestyle. And right now, cervical cancer is the #2 cancer among Indian women. And when we talk in terms of #1 and #2, it doesn't make much sense, except that in a global platform, it helps us understand what is the case contribution from our country. But when we're talking about a single person, I always feel this is the toughest cancer to face, because it attacks women literally when they are at their peak of their life, in their 40s. That's the time when things are so busy, you're bringing up your kids and you're hoping to have a future, or to see a future where they achieve things, and you yourself in your career path are moving towards the glass ceiling. And when something happens around that time, I feel the fundamental, the basement of the building gets shaken up. Your fundamental health gets shaken up, and it doesn't just affect the woman, it affects the entire family. And that is when it happens to other cancers. I'm not belittling the effect that other cancers have on families, but it happens, fortunately or unfortunately, at a much older age, because cancer is a disease of old age. So as we all grow old, we're all going to be having an increased risk of cancer. You, me, everybody. There's no one that's going to be exempt from this. Cervical cancer, the toughest part to acknowledge and to see is that it affects much younger women, women in their 40s at the peak of their life journey. And that's why we need to take action. So next slide, please, Purvika. Like I already mentioned, in India, breast cancer is #1, cervical cancer is #2. Most of the women, 50% of the women who die due to cervical cancer in the world come from India. That is because we are one of the most populated countries in the world. So even if we are looking at absolute numbers, say when we're saying 1,60,000 women get diagnosed every year and 96,000 women die every year from cervical cancer, the absolute numbers I would like to say is twice the number of COVID deaths we had during the entire COVID pandemic. So that's the numbers of women that are dying every year from a preventable disease. So when I used to train, I used to see polio cases amongst people my age. We had polio wards where people were getting their calipers fixed and undergoing physiotherapy. And polio is now a disease we don't see in clinical practice anymore. Literally, cervical cancer is a disease like that. Even though it is a cancer, it is. Do you remember seeing those people who used to walk around in calipers when we were in school? You know, kids. We hardly see them anymore because of the joint action of citizens and government organizations that literally eliminated, or at least are trying to eliminate, polio. Many people talk about smallpox, but we haven't seen smallpox as younger people. We have seen polio. So, literally, if there is one cancer in the entire world that can be eliminated or eradicated by simple measures, which cost a few thousands, that is this cancer. There's no other cancer in the world that can be eradicated. Um, and therefore, let's see what we can do about it. Next slide. This is so true that no one needs to get cervical cancer, much less die from it, because it can be completely prevented. So I'm going to tell you what are the top 2 tools that we can do and what has significantly happened in the area of this cancer prevention in the last decade. Next slide, please, Purvi. Unfortunate truth that one woman dies of cervical cancer every 8 minutes. An unfortunate truth is that majority of the women who actually die from cervical cancer are Indian. And this is because there's a huge lacuna in access to healthcare. Like, we are sitting in big cities. I'm sitting in a corporate hospital. We draw patients from Western, all over Western Tamil Nadu. Women still, despite Tamil Nadu being one of the more developed states in the country with health centers at every village and every district having a district general hospital, why women cannot access care is because cancer care is more advanced, it's more expensive, and therefore there are only certain areas in which cancer care is available. So it's concentrated in the bigger cities. So women still have to walk or travel thousands of kilometers to get access to a specialist like me. So we are still suffering from a huge lacuna in availability of healthcare, and that needs to be addressed. And that is why women are still dying of cervical cancer in India. My point today is that we should not even be having women who are affected by cervical cancer. Only then we are doing true justice to these women. The point of access to healthcare should come as a much later hurdle that we need to cross for the few cases that fall through our sieve and miss screening and miss vaccination. So basically, what is cervical cancer? Cervical, many people still get confused between uterine cancer and cervical cancer. And this is the point. This is a point that we really need to understand, that these are 2 separate things. Now, the cervix as such is a small part, literally like 2 to 3 centimeters of the lower part of the uterus. I would usually compare it to my students. I would compare it to the nose. Okay, this is like the nose that you can see on your face, and it leads inside into your nasal cavity, or the cavity which is very close to your throat, and can even get connected to your brain. So literally like that, the tip of your nose, there's something like this just at the bottom of the uterus, which does only one job. The job of the cervix is during pregnancy, where it helps when a woman stands like that. So if I can use this arrow, this is the whole body of the uterus. And this part literally here, this part is the neck of the womb, or the cervix, which during pregnancy helps like a stopper of an inverted bottle to hold the entire pregnancy for 9 months. So what happens is this doesn't grow so much, but this entire uterus here grows like that for 9 months. And it's got a full grown baby at the end of 9 months, which weighs about 3 kilos on an average. Plenty of fluid around the baby, which we call the amniotic fluid, the placenta or the afterbirth, and a lot of structures inside, which can weigh anywhere between 9 to 10 kilos. So imagine you're holding a big bottle of water with a rubber stopper at the bottom, and you're holding it inverted like that for 9 months. What the cervix does is literally plugs the pregnancy in and helps the pregnancy to progress for 9 months. And at the end of 9.5 months, it opens up or dilates to allow the baby to come in. When it doesn't dilate is when you end up having an operation called the cesarean operation to deliver your baby. So that's literally the only job the cervix does. The uterus does a lot of things. Monthly, it bleeds, so you get your menses or your periods, and during pregnancy, it holds the baby in. But the uterine cancer and cervical cancer are completely different things. Uterine cancer is still very rare in our country. It affects women who are much older. who are in a completely different profile. Generally, they are ones who are finding it difficult to have babies. They have multiple problems like diabetes and hypertension. Whereas cervical cancer is the cancer that affects the lowermost part of the uterus, which connects the uterus to the vagina. This is where sex happens, right? This is the vagina. So this is literally the opening on the outside between the legs of the woman, and then this is the vagina, and this is the part that connects the vagina to the uterus. This is the part that comes in contact to the penis when sex happens, and therefore leads to an infection, which then subsequently leads to cervical cancer. So let's look at what causes cervical cancer. Next slide. I'm going to come back to the slide a bit later. I'm going to go to the slide on HPV. Purvika, can you just run forward to the slide on HPV? So this is the most important slide in this presentation, which won an award for Zurhausen, who found out that this virus was literally the cause for almost 100% of cervical cancers. It's called HPV. It stands for human papillomavirus. Papilloma is a term that we doctors give to a wart. A wart is something like a mole that you have on your body. You can have it anywhere, but it most commonly comes on your private parts. So that's the virus that causes these warty growths on your skin. And there are different types of HPV. Some of them cause warts and some of them cause cancers. About 13 types of HPV, the hundreds of HPV types. About 13 high-risk types cause cervical cancer. So how can you get the papillomavirus infection? You can just get it by touching the wart. So when we see a wart in a dermatology or a skin clinic or in a gynecological clinic, and I'm not talking about the cancer, but I'm talking even about a HPV virus that causes a wart. If I touch that wart without a glove, and then I touch my skin, I could potentially get a wart on my finger or on my hand. So very similar to that, the high-risk type of HPV, which causes cervical cancer, can come when you're in close contact. So it can come most commonly through sex or penetrative intercourse. That's the commonest cause for spreading HPV from one partner to another, both male to female, female to female, male to male, and female to male. Everybody can get affected if they are sexually active, but it can also come through non-penetrative intercourse. Simply just touching of the private parts can also be a reason for HPV to spread from one human to another. And similarly, it can pass on from a mom to baby when the baby is being delivered through the birth passage. So it's one of the commonest infections because it can spread like that. And the number of people that get affected is generally on an average about 8 to 10%, 6.6% could be the current infection rate. About 8 to 10% usually have the HPV disease burden, which can include all of these different warts on your fingers, warts on your private parts, warts in your throats, apart from cancers, not just in the cervix, but in associated organs. So you can get it in the cervix, you can get it in the vagina, you can get it in the vulva or the external part of the female body. You can get it on the penis for men. For men having sex with men, they can get it in the anus. You can get it in the throat due to oral sex. So these are all some of the cancers that is caused by HPV. So this is not just cause of cervical cancer. But why we are focused on cervical cancer is because the majority of cancers that's caused by HPV is cervical cancer. All of these other cancers that I talked about are in the thousands, whereas cervical cancer runs into lakhs of numbers every year. Next slide, please. So going back, so what happens when cervical, can you go back a couple of slides, Bhuvika? I want to go back to the slide that I missed. So let's get here. So what actually happens when you get HPV is, suppose I start to have sex when I am 18, okay? In the next 2 to 3 years of my life, I'm definitely going to get infected by HPV. It is like having a cold every year. But what happens is if my immunity is good, immunity is what fights infections, right? So many of us got COVID. We fought the infection. We didn't land up in the ICU. Similarly, I get HPV over the next couple of years, 12 to 24 months, my body gets rid of the virus. So I'm free from HPV. I have, potentially some fighting capacity against other HPV types, and I don't develop cancer. But like some COVID people ended up in the ICU, some people with HPV, typically 10 to 15% of people with HPV will end up with cancer. We want to catch these 10 to 15%. So we label them in medical terms as persistent HPV infection, which is the most important cause for a woman to develop cervical cancer. How do we catch them? Do we exhibit any symptoms? We don't have any symptoms at all. So at least COVID, some of us had a headache, some of us had throat pain, we lost our sensation of smell. But in HPV, there's literally no symptom that will announce to the world that I've got a HPV infection once I start having sex. In the first 2-3 years or any time later, when I get the infection, I'm not going to have any infection, any signs of infection. Therefore comes testing. Because by the time my HPV infection, which is caught on to my cervix, and the next 10, 15 years, so this is not a very rapid cancer, this is a very slow cancer. And in the next 10, 15 years, slowly it's going on to form a cancer. I literally have no symptoms. I don't even get symptoms if I get an early cancer. I get symptoms much later. So what are the stages of cancer? Stage 1, 2, 3, 4. One is just in that organ or just in the cervix. Stage 2 is when it's starting to go out on the sides. So on this picture, literally the cervical cancer is going to come out like that. So third part is stage 3 is it comes to the whole of the hip region or the pelvis. And stage 4 is it's gone out all over the body, which could be the lungs, could be the liver, it could be the lymph nodes. So that's stage 4. So most of the patients that I see, when they have all of these symptoms on the slide, which is your bleeding problems or your pain, they are already in stage 3. Most of the patients that we diagnose with symptoms are already in stage 3. Most patients in stage 1, 90% of the patients will not, in stage 1, will not have any symptoms. Stage 2, 50%, about 50 to 60% do have some symptoms. So majority of the patients that we diagnose will fall into stage 2 and stage 3. Why is this important? I'm a surgeon, okay? When I got introduced as a gynecological oncologist, my job is to actually take out the uterus when there is a cervical cancer. So we remove the entire part here and we finish it off. But I can only do this operation if the patient comes in stage 1. And how do I diagnose a stage 1 patient? I almost never diagnose. So the number of cases I do in a year of cervical cancer is hardly about 10 cases. All the other cases, I do see a lot of cervical cancer patients, but what happens is when I see them, they're way past surgery. Now I've got to send them for chemotherapy and radiation because we do not remove this uterus once the cervix, the cancer even peaks a little bit out of the cervix. We can't save the patient's life by doing a surgery. So all of these patients, even though there are specialists like us sitting around waiting to do the surgeries, we don't see them anymore. We don't see them much in stage 1. We see them much later. That is when all of these symptoms are happening in their body and they come for a checkup. And then we are sending them off saying no surgery, get on with radiation, get on with chemotherapy. So what are these symptoms? There can be bleeding, any bleeding. Now, if you look at cancer awareness programs, they talk about bleeding from the nose, bleeding from the mouth, you're vomiting blood, you're passing blood in motion, you're passing blood in the urine. Similarly, you're bleeding from your uterus, which is not normal. Outside of your periods, in between periods, after sex, after menopause, any bleeding that happens outside of your normal period, you've got to get it checked. You have to check it because it could be the first sign of a cancer from this part of your body. It could be the uterus, it could be the cervix, but you've got to get it checked. Most importantly, bleeding that happens after menopause, because a lot of women do present after menopause and they feel very scared to say that they're bleeding after menopause and they don't seek care immediately. So one thing that you must take back home today is If you've got older relatives, your mom, your aunt, whoever, it's good to tell them that if they ever come across a bleeding after menopause, they've got to tell you or ask for help. But of course, we are assuming that all your moms and all your aunts have already had the HPV test, or at least after this program, you're going to make sure that they have a HPV test, right? Some of them come with pain. That's when very advanced cases, because cancers typically do not cause pain in early stages. This is true for breast cancer as well. When someone comes into our clinic and says they've got pain in the breast, we almost never take it seriously, because only about 1% of breast cancer patients usually present with pain in very late stages. This is just to say that pain is not equal to cancer. Usually a painless lump is what is suspicious of cancer, and that is for breast cancer. So the next slide, Purvika. This we've already gone through. So next slide. So what can we do to reduce this cancer that can happen in your 40s, that's caused by a virus? And we know now clearly that this virus is the cause for almost all cases, 100% of cervical cancer. This cancer that this virus that does not cause any symptom, this cancer that hardly causes any symptoms in early stages when it can be treated by surgery, and that usually comes up in stage 3, and we all know what stage 3 is now, right? It's any cancer that goes beyond the organ, and that could be a thyroid, it could be a breast, anything that goes beyond the organ and spread in adjacent areas is a stage 3 cancer. And at that point, we cannot even offer surgery, we only have to offer radiation therapy. So all of this story behind one thing, a cancer, and there are just 2 simple things that you can do to cut the story short and say, I'm not even going to allow my loved ones or the people I come in contact with to reach that stage where they're going to have through full-fledged cancer treatment. So you can do 3 things. The first thing is already happening now, which is that you're being, exposed to all of this information that you can use so very well if you put your heart and mind to it. The second thing is that many years ago, in 2005, there came up a vaccine that was directed against the HPV. And from 2008, 2009 onwards, many countries, especially in the West, started vaccination against this deadly virus. So we've got a very long-standing vaccine, which has been in practice for almost 20-25 years. And this has been in use to such an extent that just last week, Scotland published, the country of Scotland, near UK, published their data on cervical cancer incidence in children who had got vaccinated in 2009. And the best part is not a single kid that was in that particular period that had got the HPV vaccination developed a cancer now, because that's the age, right? You wait for 20 years, a kid that is, 15, 20 is now 45, 50, and you can actually see how many kids in that, maybe about thousands of kids got vaccinated in that program. When they looked at the incidence of cancer in the kids who got vaccinated versus those who had skipped the vaccination, there was no cancers in the HPV vaccine group. And why am I giving you this information? Is when you take a vaccine today, if it's a COVID vaccine, maybe in a month or 2, you will realize that you've not got COVID from your family member. But cervical cancer is a cancer that develops over many years. It takes about 10-15 years from HPV infection for the cancer to come. So we need to wait for a number of years, for 20 to 30 years, to show that this has actually reduced the likelihood of cancer. And that data is starting to come not from Scotland. Scotland is a much later country that's given that. It's come out of Australia. It's come out from many countries in Europe, like Denmark, Sweden. All of these countries which started vaccination in 2009 are now showing almost nil cancers in their population, to the extent that Australia is the first country that has announced that it is going to eradicate cervical cancer from its population. And as such, these how many cases actually they have in a year? They have about 3,000 cases. And that's the effort that they are putting in to even reduce those 3,000 cases, because it can be done by a single jab. Just one vaccination dose of HPV is enough to reduce your chances or completely eliminate your chance of cervical cancer. And what are we doing? 90,000, 1 lakh cases a year. We still don't have it as part of our national immunization policy. It's coming up maybe in the next few years. There are rumors that the government may pick up vaccination in some states, but nothing is final yet. And it's 2023. Other countries started it in 2009. We are still struggling. We are still only giving it in the private sector, which means that you have to pay. Of course, you can have it in a government hospital, but you've got to pay for it. But it's still not a free vaccine in the Indian immunization protocol. Patients are still, the cost of the vaccine is about 3 to 4,000. It may be around 2,000 now. We've got an Indian vaccine. Earlier, we used to give 3 doses. Now, the recommendation is starting from 9 years of age up to 20 years of age, you can just get away with, or you can just give a single dose of vaccine, and it has good protection against the cancer. Boys can also take it because, like I said, it can affect boys as well. It can cause anal cancers, it can cause penile cancers. And for boys, we give it up to 15 years. And again, for boys, it's 3 doses because not much has happened in boys vaccination, but we're hoping that they'll come up with single dose for boys as well. So if you've got a kid at home, if you've got a child who is 9 or 10 or 11 or 12, it's the best age to give, because the earlier you give the vaccine, the better is the immunity. And we have studies for that also. Even with this group between 9 and 20, when you looked at the under 12s, they had excellent immunity. Between 12 and 15, it was somewhat in between. And after 15, even though it was very high immunity, it still kept reducing as you grow older. And therefore, after 20, everybody needs 3 doses. Even I can get it. If I'm less than 45, you can get it. If you're less than 45, in India, the upper limit of vaccination is 45, but you'll need 3 doses because your immunity keeps dropping. Our aim is to vaccinate all kids. Now, coming to the crucial part that happens, because we're not vaccinating our kids yet, it's not part of the protocol, we are left with only one big opportunity, which is screening. What is screening? Screening is a test that is done to somebody who's normal. If I develop a problem, I have a fever or I have a headache, and I go to a doctor, that's not called screening. That's called investigating for my problem, right? So when I get a patient who's got a bleeding problem, who's got pain, I'm not screening her. I am then running some tests, I'm examining her, I'm doing some MRI, and then I'm trying to diagnose if she has got a problem. So that is called investigation. Screening is you and me. You and I do not have any medical problems. We go to the doctor and we run some tests. We find out if we are affected by some of the common diseases. So commonly, screening is done for diabetes by doing a blood sugar test. It can be blood pressure checking for hypertension. It can be your eye power checking for kids to see if they've got myopia. And similar to that, there are 2 important cancers that qualify for screening, because you've got to have certain parameters to qualify for screening. And that one of them is breast cancer. And the most important cancer is cervical cancer. What are the parameters that one should have for screening is that you should know that if you do a test, you can save lives. Otherwise, you can't keep doing thousands or lakhs of tests every year. You've got to do a test which is actually going to save the life. And one such cancer which can save a life even before cancer starts. Difference between breast cancer and cervical cancer, is that if I do a screening test for cervical cancer, I will be able to find out the HPV infection. I will be able to stop the infection from going from the infection stage to the cancer stage. When I do a test for breast cancer, it's called a mammogram, it's an X-ray, it does not pick it up in the pre-cancer stage or in an infection stage because there's no infection there. It just picks it up when the tumor is very small. There is still a cancer, but I pick it up when it is very small and potentially it's curable. Cervical cancer is beyond imagination. You can diagnose the chances, or you can come up with chances of a person getting affected by cancer 10 to 15 years before they can start to develop cancer. How amazing is that? So it gives us a long window period for us to do these tests. So even if I miss it at 30, I can still have the test at 40 and potentially save my life. So what test do we do? What is the screening test we do? It's called the HPV test. So we're going to actually look at the virus, test for the virus in the cervix, and then decide whether this person is going to develop the cancer or not. Next slide. So I'll come back to this later. I want to show you guys how the HPV test is done. Can we go to the next stage? Next slide. There's a slide on how you do the HPV test. So this is the one. So this test is done by a gynecologist. It's not a blood test. You do not go to your lab and draw bloods and then do the HPV test. It is done by your gynecologist, maybe by your doctor if they are trained to do a pelvic examination or a vaginal examination. What they do is they insert a small tube into your vagina, they open it up, and then they just rub a small brush, which is like a plastic brush or like an ice cream spatula, and just for a second, for 1 second, they rub it on the cervix, and then they break it off, put it in a small bottle, and then they send it off to the lab. So the lab that's doing a lot of tests for us is Karkinos, because they've been very kind to give it at the cheapest cost ever in India. And every year, I think for the last 3 years, we've been partnering with Karkinos, even though we have a full-fledged microbiological and molecular biology lab. I cannot afford my own lab test for my patients, and therefore Karkinos is our healthcare partner for all my patients. So this entire month, we are running a camp, cervical cancer awareness camp, testing camp, where Karkinos does our HPV testing, because they are the cheapest that we can find, and we want more women to come and do it. We don't want cost to be a barrier. So if I partner with my own lab, I'm going to have a lot of patients which say, I can't afford this cost. So Karkinos comes in as a special partner during a couple of months, January, and we run it past January into February. And we test all these women at a very low cost for HPV. So what I do in my clinic when they come in, these are normal women. They don't have any symptoms. They're more than 30 years. They look at the posters. They look at your messages. They come in. They lie on the couch. I do a simple scrap. I put in a bottle, send it to Karkinos. It's a completely validated, totally automated process that tells me whether the patient or the woman, you can't call her a patient because she doesn't have any problems. So the woman, whether she has a positive test or not. Now, if she is negative, the test is so reliable that she does not need to come back for the test for another 5 to 10 years. Like for your blood sugar test, you need to do it every year. Your blood pressure test, you need to run it every year. But the HPV test is so reliable that you do not need to repeat it for the next 5 to 10 years. The Indian government actually is telling us, do one test in a lifetime for a woman. Just do it once when she is 30 and then when she is 40. These two tests, just at 30 and 41 HPV test is enough to save a woman's life. And we've got data for that. When a woman has a test at 30 and 40 and she has a HPV test, when she reaches 60, she's not going to have died of cervical cancer. Whereas the woman who has another test, which is the less efficient test called the pap smear, which used to be done for many years from the 1970s, she needs to have it every 3 years. Unless you repeat it every 3 years from the age of 30 till she's 65, you're likely to miss it. But HPV cannot miss it. HPV test cannot miss it. And that is why this has changed the way we are screening for this cancer. The WHO, all of the organizations around the world are saying, just do a HPV test. And go back to your slides. We'll look at the WHO numbers. What they're asking us to do is making sure that women get screened. They get screened by an effective test. So that's there at the bottom of the slide. It should be there at the bottom of the slide where the WHO specifies that you've got to do a very efficient test. And in brackets, it says that this test has got to be the HPV test. You can't do a pap smear. So if your family member is going for an annual checkup and they say that she's going to have a pap smear, you need to ask for a HPV test. Many hospitals will still do a pap smear instead of a HPV test. And the second important thing that you learn today is that when there is a health checkup for one of your family members or for yourself, you need to ask for a HPV test for screening, once at 30, once at 40. And if 70% of women have these two tests in their lifetime, along with vaccination, along with doctors like me diagnosing cervical cancer, we are likely to eliminate this disease by a few years. The WHO actually called out in 2019, November, they set targets saying, please vaccinate 90% of your girls Please screen 70% of your women, and please treat your women. 90% of them should have access to a good hospital, and then you can eliminate this disease by 2030. But going at the speed at which we are going now, do you know what the projected years at which we will eliminate cervical cancer? We would probably eliminate it between 2050 to 2060. We are nowhere near these targets. Countries like Australia, which started 20 years back, are likely to meet these targets, not us. So it's up to us, and we have this opportunity to fulfill these two criteria, 90% and 70%. That's at the top of the slide. These two criteria, it's totally in our hands to be involved in the vaccination process. Wherever you meet girls under 15, to tell them to get a shot. Wherever you meet a woman who's more than 30, to motivate them to get a screening test. These are in our hands, and really the responsibility of achieving these targets are actually in our hands. No one else is going to do it. The government is still not up to it, and many times in India, it's the public-private partnership. The private companies play a huge role in eliminating many of these things, and we've got this huge opportunity to do it actually. Next slide. This we've already talked about. So these are the common vaccines that are in the market. One is Gardasil 4, and we're giving it up from 9 years onwards. My sincere advice is, if you are health educators, because I don't know what roles you play, but if you're health educators, the ideal age to give for girls is 9 to 15, even though we can give it later. The best time to immunize is 9 to 15. So if you have opportunity to talk to a pediatrician, talk to a gynecologist, talk to kids in your community, this is the age that we need to focus on, and just a single dose is more than enough. Next slide. Yeah, we're done with this. Next slide. So if there are a few important things that I need to I've spoken a lot. I'm not sure how much of it you digested, but if there are a few take-home messages, is that I really want you to act on this information. And if this information is, if you want me to break it into a few things that you want to take home with you today, one of them is educate anybody you meet, anybody who's less than 15, girls and boys, to get a single HPV dose. Any woman who's more than 30, up to 65 years of age, please present them with an opportunity to have a HPV test. And these two steps, which are just a single injection, single test, can really eradicate a cancer out of the globe. Thank you so much for this opportunity. Thanks, Suresh. Any questions? I would be very happy to answer.
Thank you, Dr. Anbu. Purvika, over to you.
Thank you very much, Dr. Anbu. That was a really insightful session, and you've given us a lot to think about and spreading awareness. And we truly appreciate your dedication to this important cause. And I think Mr. Suresh, co-founder and CBO of Karkinos Healthcare, would like to say a few words before we move on to the question and answer session.
Yeah, thank you, Dr. Thank you, Dhananjay, and the entire NHRD team for giving us this opportunity to create the awareness on cervical cancer. And indeed, I mean, I'm privileged to have Dr. Anbu. The way she has pioneered this whole initiative is, worthwhile mentioning. And when I reached out to her, for this particular slot, she was super preoccupied. And I told her that, I will not accept anybody other than Dr. Anbu for this session. In fact, I've seen her present, and I've seen her spearhead this cause. It's in fact, once again, I thank Dr. Anbu for this initiative. Just a few words, as a part of our partnership with NHRD, what we have rolled out is a comprehensive NCD program, which is primarily a program for an awareness on early detection of cancer. And this particular comprehensive program is available for all the NHRD members across India. And indeed, I'm grateful to Dr. Nathan and Dr. Prem Singh, who are, kind of able to, put this whole process together. And today, across the length and breadth of the country, our endeavor is every single organization through the HR, through their employee wellness initiatives, should be able to kind of make it mandatory for every employee or the spouse of the employee to, one, get an awareness on how they can protect themselves from getting into, possible opportunities where they can detect the cancer early. Two is we are also putting together a comprehensive end-to-end program wherein it is just not about detection of cancer, it is also about managing the cancer in case if unfortunately somebody is detected for cancer. So, as an organization, we are today funded by the Tatas, Reliance, Mayo Clinic, and we have partnerships with IIT Madras, IIT Bombay, and we have one of the best onco labs across the country. In fact, we have a capacity of over 100,000 plus square feet of onco-specific labs in Kochi, in Mumbai, in Chennai, in Guwahati, and our own hospital has come up in Manipur. So my own submission to all of you, or request to all of you is, in your own organizations, in your own families, let's start, as Dr. Anbu very clearly said, that, after today's session, if there is one key takeaway for us is, one, can we go and ask our own, spouses or our family members that, whether they have got vaccinated or they have got tested for HPV. Two is for our own daughters or our own kids in the family. Can we actually institutionalize this process of HPV vaccination? And in our organizations. So the third aspect is in our organizations. Would it be possible for us to be those instruments of change where, for us to bring this, proactive care in India is extremely difficult to kind of bring that behavioral shift. What we have seen is, if somebody is, has fever, they don't mind going and paying whatever it takes to get that fever cured. But when I come and say, hey, you are perfectly all right, just come and spend 15 minutes, 20 minutes. We will come to your premises. We will bring in our doctors. We will bring in our nurses. We will do a basic test for, cervical cancer, breast cancer, oral cancer, lung cancer, prostate cancer, cervical or colorectal cancer. All of these 6 forms of cancer, for us to do the basic first level screening program in a corporate setup is extremely easy. And we've also launched a comprehensive AI-driven a basic, what we call it as the digital health assessment, which anybody can take it, through a mobile app or through a web link in less than 10 minutes by just filling up a set of questionnaires. You will be able to figure out whether you are susceptible for any of these cancers or not. And in case, if you take up that questionnaire and if you're at high risk, we are actually bringing in doctors via a teleconferencing or a video conferencing to kind of, guide you to the next step. So, you don't have to go to a hospital. You don't have to go to a clinic. What we at Karkinos are trying to do is to kind of, Uberize the service of cancer. And we are able to bring in experts like Dr. Anbu on the platform. And, we have Dr. Shankaranarayan and we have Dr. Moni Abraham Koryakos. We have a whole bunch of doctors of eminence who are available with us to provide that last mile care. And, with the facility being available, with the options being available, and technology actually playing a very critical role in kind of, enabling this availability and accessibility. And as Dr. Anbu said, in terms of, bringing down the cost of, the early detection to a phenomenally different level because we do at volumes. We are able to bring in today a HPV DNA test or a HPV vaccination at your doorstep, leveraging technology and leveraging our partnerships. So my sincere request to all of you is to kind of take the first step, be it in your families or be it in your communities or be it in your organizations. We will be more than happy to kind of support you in every single form, whichever place you are in. And all the details are available with Avinash. And in case if you want to reach out to any of us, you can reach out to us. Purvika, maybe you can drop in our email IDs and phone numbers on the chat bar, where anybody can reach out to us. We will be more than happy to collaborate with all the NHRD members on this initiative. And once again, I thank Dhananjay and a special thank to Dr. Anbu for taking so much of our time and giving us phenomenal insights with so much of clarity on this auspicious day of the 75th year of the Republic Day for India. And obviously, as we celebrate this day and as we give our gratitude to all our leaders, we also probably will take an oath on this day that every single woman that we meet in our lives, we will educate them, or we will be the source of that inspiration for them in this endeavor. Once again, thank you so much, and look forward to any questions that you may want to ask Dr. Anbu. Getting our time is not so easy, so I will stop here and wait for all of you to exchange your questions with Dr. Anbu. Thank you very much. Thank you. Purvika, are there any questions that are already there, or anything that you want?
If any of the participants have any questions, you can go ahead and unmute yourself and ask the questions. We are still in touch with the social media team to get any questions from YouTube or Instagram where we're live right now. So in the meanwhile, if any participants have any questions, feel free to go ahead.
I have a question to Dr. Anbu. One is on the cervical vaccination. Are there any possible after effects or anything that you would want the parents to be careful about?
So the only side effects that we are seeing is local side effects. It's pain in the arm because it's given in the shoulder muscle. Unlike other vaccines like DPT, it doesn't cause fever. So that's a very rare side effect. Many years back, in fact, when I talked about 3 doses for more than 20 and 1 dose less than 20 years of age, that data came out of India where ICMR was doing a huge trial, and there were kids that were getting vaccinated for 3 doses. And there were some so-called deaths that were noticed, I think 8, and the ICMR abruptly stopped the trial. And after that, the HPV vaccine found it very difficult to come into the Indian market. All the other countries took it up. We got very wary, but there is Gavi, which is the international alliance that actually does its study into vaccine-related deaths, and they found that none of these deaths were related to the vaccine. So even if I took the vaccine and crossed the street and I had an accident and I died, it would be considered as a vaccine-related death. So all of these girls got only 1 dose at that point, and the data has actually come out of India that these girls that got 1 dose, when they were compared with their international counterparts who completed the 3 doses, still had good immunity. And that's how the dosage schedule actually changed for the entire world. So some good things come out of bad things, I think. But the bad thing that basically put HPV out of circulation in India for a long time, which denied us this opportunity to give the vaccine to our kids, where we could have taken several steps towards elimination, were proven to be not true. So the simplest side effect we see is pain in the injected site for a couple of days, maybe a little bit of soreness. Some kids get fever, but other than that, we've not seen any major side effects. At least I haven't seen any.
Thank you, Dr. Anbu. This is one of the questions that keep coming up when we speak to professionals about it. Anyone else?
5 years of data from several countries across the world. And we did not want to experiment on our kids, but we still have data from around the world. And it's a very safe vaccine, actually speaking.
Sure. Thank you. Thank you so much for the time.
Thank you. And since it's a very sensitive topic, so maybe if any of you would like to ask questions, you would like to email the questions to us, no problems, do that. And anyways, we are planning to share this video. We have already, while the session was on, we have shared on various WhatsApp groups also. And we have got some very, very enthusiastic response from very senior professionals. So in case, knowing the sensitivity, in case if you want to write down your question and send it later, no problems at all. We'll be happy to collate and share with Sureshi and the team, so that at your convenience and convenience of the expert, we can come back to you. To me personally, it was really eye-opening, and thank you so much, Dr. Anbu. Thank you, Sureshji, for giving all of us this very important opportunity. And I'm sure that this kind of awareness webinar will not only help people to understand the gravity, but also it will help them to know that small steps, and as rightly Dr. Anbu said, that if one vaccination or twice in a lifetime is done, it reduces the chances a lot. So that this itself is so much reassuring that by our conscious effort and action, a lot of prevention can be done. So this was not planned, but I was moved to share this with Sureshji and Dr. Anbu. Please, thank you so much. Over to Bhuvika ji, please.
Thank you.
Thank you so much, Mr. Dhananjay. Dr. Anbu, I do have one question. So, with respect to the Asian context, there is still a lot of cultural taboo around sexually transmitted diseases like HPV, which is a sexually transmitted virus. So, parents are also not willing to have that conversation with their children when they want to get them vaccinated for against HPV virus. So, is there a way that we as healthcare providers can demystify that taboo and encourage people to protect themselves against potential viruses that can potentially lead to cancers like cervical cancer and penile cancer?
This is truly the biggest barrier that we are facing. So, healthcare professionals generally don't use the word sexually transmitted infection, because here we are not really talking about preventing the implications of the virus on the act of on the act of sex, right? So, when you have other common sexually transmitted infections, you end up with discharge, you end up with burning. There's actual physical symptoms that are happening in your body. Although this is transmitted through the act of sex, that's not the only thing that transmits it, right? You can get it from just close contact with somebody. So that could even be, two siblings maybe playing together, or, having a wart on their hand. So HPV is that ubiquitous. Therefore, as a general rule, we do not say that the vaccine is given to prevent a sexually transmitted infection. It is given to prevent the most common viral infection that you may acquire through sex, but also through other means. But most importantly, it's singularly the most important cause of one of the commonest cancers. So, what I generally tell is, see, when you look at the cancer distribution in Indian women, if you have 100 women, 25 of them are going to get cervical cancer, 27 of them are going to get breast cancer. Okay, so if you've got a pie, half of that pie is breast cancer and cervical cancer, and the other half is all your other cancers. Literally, the entire body, all of the other cancers, starting from brain to the bladder, everything is going to be in this other 50%. For this half of the pie, if I give one vaccination, I'm literally going to have 1/4 of the pizza attended, right? By a single dose. And regardless of how it happens, you're going to get the infection anyway. If you're planning to have your child, unless your child is planning to go into a nunnery, right? Those are the populations which do not get the infection. Whether you're monogamous, whether you're polygamous, it doesn't matter. Whether you're male to male, female to female, doesn't matter. Every one of us who ever indulges in a sexual act, even if it is once in your lifetime, you can have the HPV infection. So it is not a mark of whether you are promiscuous or not. Do monogamous couples get it? They still get it. The wife of a monogamous man still gets it. So we don't know how. There's no way to explain it. It probably is there in the air. It's probably there on your toilet seats. We don't know. We do not delve into that. But what I literally say is this 1/4 of the pie is going to go away by a single injection, provided you take it at the right time, provided you do the test at the right time. So it's not to prevent the effects of a sexually transmitted infection and attribute it to sexuality, or attributed to a judgment on your sexuality. It is attributed to preventing the most preventable cancer in the world. So use the word vaccine, use the word cancer. Okay, downplay, if you're actually having conversations with people, downplay the sexual part or the sexually infectious part. That's how you can address this. But I think times are changing. More and more people are coming forward to have this conversation, more awareness about STIs, more awareness about the vaccination is still happening. Most of the people that I don't have time to actually do the vaccination conversation in my clinics, but I do have parents come in with their kids just asking for the vaccine. They don't ask us anything else. The information is getting across, and this is actually a really good time to harvest the effects because it's spreading all around us through the internet access. So for us to just set a reminder is all that we need to do, is what I'm guessing.
So doctor, I have a question. So those who have already crossed the vaccination age, so you said up to 45, the vaccination is still, 2-3 doses will still work. But those who have already crossed that age, of course, the option of screening, early screening is available. But is there any other means by which the immunity can be, is improving on the immunity the only option for them?
We don't have clear-cut criteria on what you can do to improve your immunity to bypass the effects of vaccination. We do not have recommendations on that. You can be the healthiest person on the planet, the fittest person on the planet, and you can still get struck down by the HPV virus. And we do see, although this is a disease of the lower socioeconomic status, we see a lot of people who are in the upper strata, very well taken care of bodies, and they still do get the HPV infection and cervical cancer. And you know that many of these are also epigenetic related changes, right? Of how your body reacts to this virus, why it gets adherent to your cervix, doesn't move out, doesn't get cleared. We really don't know. So if I would start to give advice on how to improve your immunity, I'm going to take the focus away from what we really need to be doing, which is getting yourself tested and getting vaccinated. There's no replacement for these two roles. You can't bypass these two roles and eliminate cervical cancer. So if you are up to 45, please go ahead and take the vaccine, because there are 13 different types. So I could have got affected by one type. I could have immunity by that one type. And over the ages, I might get infected to another type. That's the basis of having the vaccination done up to 45. And that's also a lot of data up to 45. And therefore, safety data in terms of even if you take it up to 45, even if the opportunity for reduction of cervical cancer risk is less, you still want that opportunity, right? You still put on a seat belt, even though it might not completely prevent you from dying during an accident. You still put it on, but that's the single most important step. You can't have any other interventions to bypass the protection that a vaccination and a HPV test will give. The other important takeaway is, even though we are vaccinating, the protection is not 100%. So when we look at kids up to 12, the protection is in the range of 98%. When you're looking at 12 to 15, it drops down to say 95. When you're looking at 15 to 20, it may drop down to like 89, 90%, which means that there is that 1% chance that you're not reacting to the vaccine the way you need to, right? So you can fall through and develop a cancer even if you get a vaccine. Therefore, there's no substitute for the testing. It does not mean that if you have the vaccination, you do not get tested. You still need to get tested, but with the HPV test being so good and so effective, you just need one test in your lifetime. So vaccinate at 15, have the test at 30 and 40. So that should be the way we are going forth, because you want to give yourself 100% chance of not ever getting a cervical cancer. I would not wish it on my worst enemy. So why would I bypass these two things, right? So there's no answer to your question. There's no other measure that can help to improve your immunity. You must get the test done. You must vaccinate whoever's under the bracket.
Thank you.
I'm guessing we'll call it a day then.
Yeah.
Thank you. Thank you so much, Dr. Ambu. If there are any further questions, please feel free to reach out to us personally via email or message. And as we conclude this event, I would like to express my heartfelt gratitude to Dr. Ambakani for making this event a great success and for sharing her invaluable insights on this very needed topic today. And I would like to thank Mr. Dhananjay Singh and the entire NHRDN team for making this event possible and for their unwavering support throughout this event. And thanks, Mr. Suresh, for making this event. Thank you very much. Thank you to everyone for joining.
Thank you. Thank you so much.
Thank you all.
Thank you.
Thanks, Suresh. See you around.
Thank you. Thank you.
Thanks.
Thank you, Dr.